Alright, now we're gonna go learn about health promotion, osteoarthritis, osteoporosis, and sleep. So excited to learn about a bunch of objectives. So, we know health promotion does not works for all ages, but not for everybody, not all the time. The two biggest things when it comes to health promotion, two biggest things to focus on, what do you think they are? Exercise and nutrition. So, in older adults, what are our ways that we can get people back into exercising and eating right? Re-engaging them in different things, so like trying new stuff. So, health promotion models, we got the HealthWise, which is what? It's like a handbook, gives you guideline for prevention and management for a bunch of health problems, and also tells you when to call a provider. Then we also have the Project Enhance, and that's for what? Enhancing fitness and wellness. And then we have cardiac wellness for heart disease or heart surgery. What's the Dean Ornish Reversing Heart Disease Program? Basically like a plant-based diet focusing on aerobic exercise, meditation, no smoking, and group support. What is the Herbert Benson Mind Body Medical Institute program? Focus on like meditation, relaxation, reframing negative thinking, and then nutrition and exercise as well. So, there have been a bunch of changes to medication over the past decade. What do you think some of those are? So, we have an initial physical exam when you turn 65, basically focus on everything. You get annual wellness visits, smoking cessation. You get those health programs that we were talking about, the Dean Ornish and Herbert Benson. Obesity screening and stuff like that, depression screening, alcohol counseling, up to 4 of those, and then the biggest thing here is elimination of all deductibles and co-payments for prevention services to enhance access, which is nice. Okay, so we got some health promotion activities. Well, what do you think? We got like primary, secondary, tertiary. What is a primary prevention? It's like immunizations. They're designed to prevent disease from occurring. What do you say secondary prevention is? Screenings, colonoscopy, and mammogram. It's for early detection and management of disease. And what would you say tertiary prevention is? Like cardiac, stroke rehabilitation, management of clinical diseases, prevent them from progressing and avoiding complications. All right. Then we have screening. We know that's what level of protection? Secondary. We have the USPSTF endorsement level. What is level A? Highly recommended. And level B? Recommended. What about C? Recommended for some. How D? Not recommended. And I? Insufficient data for recommended. Okay. All right. So, when we're doing health promotion, what are some of the main areas that we need to focus on? Physical activity, nutrition, tobacco use, health screening, injury prevention, preventative meds and immunizations, and caregiver support. Focus on preventing frailty. Okay, so physical activity. What is that basically attributed to? Physical activity is basically causes what? Functional decline. So how much activity should the elderly get? 30 minutes of brisk walking, 5 more days a week. But what are some barriers to physical activity? Lack of access to safe areas to exercise, pain, fatigue, and impairment in sensory function and mobility. All right, so what are some signs of poor nutrition in the elderly? BMI under 19, they're gaining weight or losing weight, they have an albumin less than 3.4, cholesterol is less than 160, their hemoglobin's less than 12, and their serum transferrin is less than 180. So, how can we educate them to change their lifestyle? Get like a health contractor calendar, motivate them to do exercise. Older adults we know are vulnerable to both obesity and malnutrition. What are some things that contribute to malnourishment? Social isolation, dental problems, medical disease, and medications. And what would you say nutrition bullseye is? So it like targets the most nutritious foods for the older adults. So like if you have an orange and an orange juice, the orange would be closer to the bullseye than the orange juice. And then we have a Mediterranean diet. What do you think that is? Like more costly, reduces risk of cardiovascular disease. It's like focused on low meat, healthy fish, stuff like that. All right. Tobacco death. What do we know about it? Leading cause of preventable death in the U.S. Older people benefit as much as younger ones from quitting smoking. Can decrease chance of having an MI or dying from lung cancer or heart disease. And what are the 5 A's for quitting smoking? You're going to ask. You're going to advise. Assess willingness to quit. Assist using counseling for pharmacotherapy. And arrange for follow-up within 1 week. Okay. So, what type of patients What certain be some reasons that we would have to do a full multifactorial fall risk assessment on an adult? If they've had more than one fall, if they have injury requiring medical care, and they have difficulty walking under balance. So, what's some questions I'm going to ask them? Have you fallen in the last year? If they say yes, what's the circumstances around that fall? Do you have difficulty with walking or balance? If they say yes, like an extensive fall risk assessment, okay? I know about polypharmacy. All right, immunizations. Tell me about the influenza immunization. Annually, 65 plus. What about the high-dose influenza immunization? People with multiple comorbidities got 4 times the amount of the regular. What about the pneumococcal pneumonia immunization? 1 time, 65 plus is most prevalent. What about the tetanus and diphtheria immunization? Booster every 10 years for all over adults. What about the herpes zoster immunization? 1 time for age 60 plus. So what are some important screening areas that we got to focus on? Mental health, alcohol abuse, elder abuse and neglect, heart and vascular disease, stroke, thyroid disease, osteoporosis, vision and hearing, prostate cancer, breast cancer, and colorectal cancer. All right, what do we know about depression? It's a risk factor for heart disease, experiencing loss, a decline in functional capacity, it increases mortality, it's got a high suicide rate in elderly, and it's undetected, undertreated. This kind of sucks. All right, tell me about the types of bones. We got osteogenic cells, we got osteoblasts that basically make the bone, osteocytes, and osteoclasts. They break down the bone. Bone stores minerals such as calcium, and you have a basic multicellular unit. And then we have stuff like that. Okay. All right. What's a bone loss? It's negative BME balance. What is trabecular bone? It's a majority of bone resorption. It's weaker with age. And what is the cortical bone? Loss occurs at half the rate of trabecular bone. Estrogen is important here. Why? It promotes apoptosis of osteoclasts, which is good. And what is osteoporosis? Reduction in bone quantity and strength. What's an immovable joint? Fibrous joint, collagen, sutures in the skull, cartilaginous joint. These are like slight movements of the vertebrae. What about synovial joints? It's like synovial fluid helps joints move easier, such as like the hips, legs, shoulders, things like that. All right, tell me about osteoporosis. It's got low bone density or porous bones. What's the biggest complication with osteoporosis? Bone fracture. If you're a female greater than 65 years old, you got to focus on the BMD. How do you prevent osteoporosis? Diet and exercise. And how do you treat osteoporosis? Biphosphonates or HRT. Tell me about arthritis. OA is most common in older people, but arthritis, what is it? Is inflammation of the joints with a risk factor for arthritis. Obesity, joint injury, occupation, muscle weakness, gender, age, and race. What are signs and symptoms of arthritis? Pain, morning joint stiffness, aching, joint swelling, and inflammation. What are the interventions of arthritis? Lifestyle modifications, non-farm, and farm therapies. All right, who would need a joint replacement? Maybe if they had a fracture, immobility, or intractable pain. And what would we do post-op after joint replacements? Weight-bearing instructions, rehab, and focus on wound infection, things like that. Okay, make sure you skip this. All right, tell me about sleep with the older adults. They go to sleep earlier than us, but they wake up earlier than us. Now, what's sleep efficiency? Time you spend when you are trying to sleep. Insomnia leads to delirium. Okay. All right, so we have sleep and quality of life assessments. So basic sleep assessment instruments. What's the Epworth Sleepiness Scale? Assesses the presence and severity of daytime sleepiness, also sleep apnea and narcolepsy. What is the Pittsburgh Sleep Quality Index? Assesses your perception of sleep and subjective sleep quality. You gotta stop bang. What's the Cambridge-Hopkins restless leg syndrome questionnaire? Focus on how much you move like your legs and insomnia. Then we have a polysomnography. What is that? It's a diagnostic test for apnea. It's 10 seconds, and hypopnea. Then it's acetography. I don't think that was important. Okay, we have CAM. What are some CAM things for sleeping? Acupuncture, Mind, like cognitive behavioral therapies like stimulus control, which is like the bedroom relaxation, paradoxical intention, sleep restriction, decreased time in bed, sleep compression, and sleep hygiene education. So like a routine. Don't really recommend sleep aids, avoid stims, exercise, and limit liquids during the night. All right. Is melatonin show any significant benefit for insomnia? No, but you can do like slow back and hand massage, tai chi, electrical stimulation, stuff like that.